Wednesday, and time for another edition of 10 Minutes of Truth. So today I've got two fairly recent articles on gabapentin, and I wanted to go over what exactly this gabapentin is. A lot of people take it, and what the literature is saying about it. So this first one was July 10th of this year. So it's a very recent article, like 1 month ago. It came out in a journal called Regional Anesthesia and Pain Medicine. Risk of Dementia Following Gabapentin Prescription in Chronic Low Back Pain Patients. So this is a big study. And it examined whether gabapentin prescriptions are associated with dementia in adults with chronic lower back pain. They looked at over 26,000 adults. So this is the first large scale study that's ever been done on gabapentin. Now, what is gabapentin? Well, it's a pharmaceutical that was approved in 1993 to treat seizures, but it's been used since then for the treatment of chronic pain, actually for about 20 years. It's a common treatment for chronic pain, and its use is increasing regularly. The most common side effects from gabapentin include sedation, dizziness, gait instability, and somnolence. It's often used as an alternative to opioids. Now, what this study wanted to see was, does gabapentin pose a risk for cognitive mental decline or dementia? And the findings of this study is this: our analysis yield an increased risk of dementia in adults in the gabapentin cohort compared with the no gabapentin cohort. So they looked at patients taking gabapentin, patients not taking gabapentin. They said among non-elderly patients aged 18 to 64, gabapentin prescription was associated with a greater likelihood of dementia. When comparing varying frequencies of gabapentin prescriptions, above or equal to 12 prescriptions versus 3 to 11, in adults, we observed elevated risk for both dementia and mild cognitive impairment in the higher prescription group. Patients with 6 or more gabapentin prescription had an increased incidence of dementia by 29%. Patients with 6 or more gabapentin prescriptions had an increased incidence of mild cognitive impairment by 85%. Non-elderly adults ages 18 to 64 prescribed gabapentin had over twice the risk of dementia, 110%, and mild cognitive impairment, 150%, compared to those not prescribed gabapentin. One of the things that this article said was chronic gabapentin exposure has also been linked to reduced neurogenesis and synaptic plasticity in memory-related brain regions. Okay, let's look at the second article. Was from 2023. It's from British Medical Journal. And the name of this article is Association Between Chiropractic Spinal Manipulation and Gabapentin Prescription in Adults with Radicular Lower Back Pain. So they had 635 patients in both groups. One group got adjusted, one group just took gabapentin. One of the things this article said that I thought was interesting is that together, low back and neck pain account for the leading cause of medical expenditures in the United States. Radicular lower back pain, that means back pain that's radiating down one of the legs, is often treated off-label with gabapentin or by chiropractors using chiropractic manipulation. This article also stated this about gabapentin, which is pretty interesting. Systemic reviews in 2018 and 2022 demonstrated clear evidence of the lack of the effectiveness of gabapentin for radicular lower back pain. Several clinical practice guidelines do not recommend gabapentin for the treatment of lower back pain or radicular lower back pain, including those of the American Family Physician. Gabapentin prescription for lower back pain is described as a marker of low-value care and medical overuse. Now, this article went on to look at what chiropractic care could do for lower back pain. And it said that patients initiating care for lower back pain with a chiropractor compared to other providers have a reduced odds of receiving an opioid or benzodiazepine prescription. And it said here that if you look at people that have gone to a chiropractor and people who haven't, they said that the people who have gone to a chiropractor after 1 year were significantly lower compared to the ones receiving medical care. It was 47% lower. So if you went to a chiropractor, you'd have 47% less chance of having to take something like gabapentin. These real-world findings support our hypothesis that adults initially receiving chiropractic care for radicular lower back pain have reduced odds of receiving a gabapentin prescription over a 1-year follow-up period. So it looks like chiropractic care is pretty effective for lower back pain and radicular lower back pain. And as we saw in the first article, taking prescriptions of gabapentin results in, or could result in, dementia. At least it results in a much, much higher percentage of people that get dementia. When I was reading these articles, I thought, can you imagine the outcry and the anger if chiropractic care resulted in dementia or cognitive impairment? I mean, you'd never hear the end of it. But it's not chiropractic care. Chiropractic care can actually help people avoid taking pharmaceuticals like gabapentin that raise your chances for getting dementia. So as usual, we recommend chiropractic care for lower back pain, for leg pain. We treat those things and we correct those things here at Lincoln Disc and Nutrition. And we recommend, if you have those things, before you go out and get a pharmaceutical that could give you dementia, call our office at 402-488-2220 and see if we can help you. See if we can help you with getting rid of your pain naturally and without pharmaceuticals. That's what we do here, and that's what we'd like to do for you. So until next week, we'll see you then. This is Lincoln Disc and Nutrition, Dr. Paul Firnhaber here in Nebraska, and hope you have a healthy and wonderful week. See you next week.